Hey, Off-White Coat listeners, it is my privilege to get to tell you about this sweet deal from our friends over at Picmonic. If you haven't heard about Picmonic, it is a fantastic picture-based mnemonic platform that can certainly help out any student. Most of the videos are around 2 minutes long and provide a quick and effective way to memorize material for any upcoming medical exam. It is extremely efficient. They have this search bar function where you can search playlists on general topics like renal to step 1 to step 2, or even first aid and other books. If you want to review the Picmonic for later, you can even make a playlist of your own. Picmonic even has this repetition algorithm that is spaced out according to your learning needs. This helps with increasing long-term retention and allows you to review the right information at the right time. One of my favorite functions is the quizzes that are associated with each Picmonic. I'll take the quiz first and then learn about the associated pictures and what facts I need to sharpen up on. Honestly, Picmonic is a fantastic tool, and if you use our code OFFWHITECOAT, you'll get 20% off. That's Off-White Coat with no spaces. So what are you waiting for? Make studying the easiest part of your day. Sign up with Picmonic and use Off-White Coat to save yourself some money. Hello everyone, this is Jordan Abney and this is the Off-White Coat podcast. This is a special episode. Right now I am studying for STEP. And I'm in my dedicated period. I have about a month of grinding before the actual test. Yeah, so this is just going to be a special, quick one. I'm joined today by Mary Bess. She's going to be helping me out. I think she's got some questions for me as well. And yeah, so thank you and enjoy.
Yeah, okay. Yeah, can I start with my questions?
Just go for it, yeah.
Because, I know about STEP just because of you, but, for the people who don't know about STEP.
Yeah.
What is it?
Explain, what do you think STEP is? Yeah, what?
Well, I feel like
I can explain it to people that might not be.
Okay, so throughout medical school, you have these milestone tests, like any, other profession, like a law school, you have to take certain tests.
Yes.
Nursing school, blah, 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 teachers, blah, blah, blah. You have to take all these tests to basically become one, right?
Yes.
And, I had no idea about what a doctor did or what test he took. So, when we started dating, you were starting to study for the MCAT.
Yes.
And then last year... So, the MCAT is basically...
That was an interesting time, too.
Yeah. MCAT is your first big milestone
That's
test.
to get into medical school.
Yeah. That's to get into medical school. It kind of weeds the people out initially. Step 2 is your second biggest milestone test, wouldn't you say?
Yeah.
Right? you have tests throughout school.
Step 1 is the first one. You said step 2, I think.
Sorry. Step 1, God, I'm so focused
the
on
one
step,
that, yeah.
I'm so focused on step 2 that, okay. Step 1 obviously comes before 2. So 1 is right after 2 years of schooling, correct?
Mm-hmm. Yeah, when you're done with the actual science part of medicine.
Yeah, so it basically goes over everything you've learned, or I guess maybe haven't learned.
Yeah.
Everything. Hopefully.
And it's on the nitty gritty, the sciencey parts of the, not how to treat, but what is the DNA mutation in this? Or what is the specific enzyme that these, or there was this specific white blood cell. What is the enzyme that this one uses? Things like that. You're nothing to do, and then step 2 is more clinical, where you're what is the management? Yeah. Oh, yeah, I'm just saying that. It's a nitty.
So then you do a year of rotations and then take step 2, which is what you're studying for now. And with COVID being a wrench in everyone's system, it's kind of been actually, I guess we've been really right at a year. But some people have been a little less, and some people, I don't know. But anyways... Step 2 is basically over your rotations and stuff like that, right?
Yes.
Okay, cool. So,
or about management of the patient. It's
oh, okay. And drugs and all that stuff, medications.
Yeah, and I guess step 1 was that too, but it might be what medication should you use, something like that. Yeah. It's definitely a progression of when you read, and it's an interesting thing when you first start medical school.
when you first start medical school, you can like look over certain vitals and stuff. Like you're like, oh, blood pressure. They're only going to give me like the key phrases I need to look for. So you're like, oh, blood pressure, they're always going to be normal. Heart rate, that's always going to be normal. I can just skim through the question.
Yeah.
But then as you get further and further, you start to realize that they're starting to like take just little pieces of that conversation, and then they're like, this all looks the same, but then there's one thing that stands out that makes it this. Okay. And so you're kind of like progressing up to like, oh, okay, now I know how to manage it. Like it was a simple question before. It'd be like, oh, this person just has like arthritis or whatever. You need to be able to determine that the joint pain was arthritis, but now you need to know what to do and what type.
Okay.
So there's a little bit more, and so it makes it incredibly more difficult every step.
Yeah, because it gets more descriptive, or like the answer choices are like so particular that, or they could all be right, but you have to find the one that's
the worst. Yeah,
absolutely the best. Like,
where there's definitely some where there's two answers, and you know that both of them technically in a way could work, and you're like, oh, son of a bitch, what is this question trying to flesh out of me? And then there's also ones, and this happens a lot too, because they'll ask it like non-descriptly, and then they'll be like, what is the answer? And you're looking and you're like, oh my God, like, oh, is it this one or is it this one? Like, you're like, it could be. There's not really a good answer, but there's the best answer out of a bunch of not very good answers. And so they're like, oh yeah, it's your best answer. Well, it's like, the actual answer isn't on here.
Right, yeah.
You know, you're like, so your brain's just like screaming like, this is the answer, but it's not on there. So you get so like caught up in that moment that you miss a question.
Yeah, or you waste time. Or both.
Yeah, or you miss, yeah.
Step 2 basically is what Jordan's studying for now. He has been going all day, every day since he finished OBGYN. Coming up, this will be what, your second or third week of dedication? Second. So let's talk about like your plan.
Okay.
For studying for step 2.
So step 2 is a beast. I think it's 8 hours total, something like that. So I cannot sit still. It is a natural problem. People have said it from birth but since I was a little kid that like I had the attention span of a squirrel and blah, blah. I could do questions if I could walk around and do questions, but the sitting, which is a big element to step, because that's what I do during step is I sit for an hour, get up for 10 minutes, sit back down for an hour. That hurts me so much that I have to train myself. So what I've been doing is doing about 160 to 200 questions every day, just cranking them out, like making sure that I sit there, do the questions. There's been a couple distractions and I've had to pause it or whatever. But yeah, so I really have been trying to get, because that test is going to be almost that many questions anyway. And so I kind of am treating it kind of like a marathon, right? You wouldn't want to run a marathon without ever practice, you wouldn't want to run a straight marathon, 26 miles without ever running 13. You kind of want to work your way up. And so what I'm doing now is getting my body in the zone. So I've been cranking out questions, and I have 2 test banks. We can get to that in a minute. But I've been cranking out questions and trying to get myself in. And then in this week, I will start to do more studying, like actual material-wise, like getting them, because I did a bunch of questions and then I did an assessment, and the assessment did not go as well as I wanted to. I would like barely pass. We got a lot of improvement to do, ladies and gentlemen. But yeah, so what I want to do is I want to get myself up to speed, and then I want to get some material in this week and keep myself at that like running speed, like where I'm doing 40 questions timed, boom, 40 questions timed, boom, 40 questions timed. Because, like, I prefer to do the questions where I get to see the answer after it. Like, I think about the question, I get it, I can put it in my notes, and then I go to the next question. Well, that's not how this test is. It's timed. You don't know the answer. Sometimes you just got to make an educated guess and move on. And so you got to try to train yourself to think like that. And so that's been the hardest part is getting back in that like testing feel.
Yeah.
And you have to like train yourself to be tested, which is the worst because you're like, let me mimic a test day environment, which is just causing undue stress on yourself. You know, you're like, well, how do I mimic a test day environment? Well, let's just run around like crazy and then freak out for a little bit and then try to take the test.
Right. When you're at home having to study with your dog and your girlfriend and the TV and people calling you and, you know, like, and I'm just saying that's your situation. Like, other people have, like, siblings and parents and, you know, coming in and out. And, I mean, that's kind of actually how you were last year when you were studying for STEP. You were stuck at your parents' house because it was COVID, and then that was a struggle because you have little sisters running in and out wanting you to play.
It was
and
literally,
dogs and...
it was constant. It was a constant cycle of something. It was a dog had to go out, or somebody had to go do something, or somebody come in, but I found a way. Then I secluded myself. Luckily my grandparents have a cabin, and I was able to go there and just like heavily seclude myself. Here it was funny because when I was doing that assessment, I'm doing the assessment, so I'm just cranking out questions. And my dog, Riley, she has like the most hyperactive bowel during this moment. Like you can just hear it gurgling, like it was like, and I'm like just looking at her and then doing a question, and then she's like, and I'm like, are you okay? And so I do another question, and I'm like, I'm not going to be able to finish this question block before she's got to go to the bathroom. She just looks at me like casually, and I'm like, there's no way. Like it's just I'm like, poor girl. But yeah, so it was some of that. There was that in the distraction period, but I can't blame that on what. It was just funny, to be honest.
What kind of advice do you have for people to get in a study environment then?
Oh, okay, yeah. So I guess the best way, and that's what's been told to me too, is I think the best way to get ready for these tests is like what I was explaining, and it's probably one of the hardest parts, is changing your study to mimic the test. Like what you're doing is you're actually, I had no problem with my medical school exams at all. I got either A's or a high B. I studied very hard for them, but there was never a concern that I wasn't ever going to get, that I was going to pass. You know, like I knew that I knew my material well, and I knew that they were going to ask me about this because this is what they taught, this is what they emphasized. I knew they were going to ask certain questions or harp on things. With this, it's totally different. Like you think you know what they're going to harp on because you were taught from your school, but this is kind of like an IQ test, so they can bring in anything, and what it does is it makes it super difficult to know what they're going to question you on, and so that you want to study, and that's a long roundabout way of saying you want to study for the test. You don't want to study just overall all medical stuff. You want to study like do assessments for the step. And and that's what I was saying too, is that you do 40 questions, you do it timed exactly how they would do it, and then you can review after that. And I think that getting in that mindset, getting in that where I know that I'm supposed to do 40 questions timed. I get that feeling of how it feels, even if I don't know the actual answer, you know, and you're trying to make a good guess. I think doing all that and not giving yourself leeways, like not giving yourself, oh, I don't know what this question is, what this word is, let me Google it. No. You have to guess because this is how it would be on the test.
You're not going to get to Google.
Yeah, but like, you know, if a word pops up and you're casually doing questions, you're like, I don't know what this is. Like, prime example is ciguatera. We'll talk about that in a second. But that popped up on my assessment. I was like, I don't know what the hell this is. And that was the actual answer. And I was like, which luckily I just narrowed all the other answers out. It was like, it can't be this, it can't be this. This is all stuff I know. But you're like, so I think the best way to study is to actually get in the mindset to take the test and focus on what they're actually harping on. So do the assessments and the best way to study for STEP is UWorld. Do UWorld and do timed assessments. And I would do a bunch because that's the problem is when it comes to test day, it's going to be like a marathon. It's not going to be a sprint. It's not going to be about how much you know. It's going to be about how much you can show during that day. Like, if you know everything, but you gas out at 4 hours, test is still going to go on.
So how many breaks are in the exam?
I know you get to moderate your own breaks, but I think it's after every block you can take a break. I know one guy did like 3 blocks straight when I was doing step. I was like, wow. He was like, I took an Adderall. I'm just going for it.
So that might be your gassing out thing, though, where he's like, boom, let me get this done while I have the energy. But then he's going to take a break and then be kind of dull later.
I think you get
funk.
Yeah, I think you get an hour, like a break time, but it's like spaced like 10 minute, 10 minute, 10 minute, or it would be.
Yeah.
And I can't remember how I did mine. I think I did mine when I took step 1. I think I did like an 8 minute. I gave myself room for a larger break. And then halfway through, I was like, fuck it, let's just go. Which, I was just like, let's go, finish this thing off. And then, so I didn't, I think I used my break time, but because I saved some time to like eat and stuff, I had saved some, but at the end, I was just ready to get it done. You know, I might have even finished I would have had 5 minutes left, but I just didn't take it.
So, I guess everyone can do what they want, what works best for them. But in order to know what works best for you, you have to practice, like you said, for the marathon. You can't just jump in it. Otherwise, you're like, well, like that guy, he could have been practicing like, okay, I'm going to do 3 question blocks and then take a break.
Yes.
I have the energy, might as well, But then other people are practicing like, I'm going to do 1, take a little break. I'm going to do another 1, take a little break. And then I'm going to do 3 and then take a larger break. I don't know. Like there's different ways, but you don't know until you sit down
and test yourself.
And really, you test yourself. Yeah.
And yes, that is the key that I would like to stress is that everybody is different. Everybody's different. And everybody has their own opinions on what they should do. You go on YouTube right now, you will find 150 videos on how to score 270 and above. I scored this. This is what I did. This is what I did. And I watched so many of them because I want to know what other people did because I want to be successful, and I'm willing to put that work in as well.
They might have a really good idea, but they might have a really good idea too that doesn't work for you.
Exactly. And that's what, I like to listen to what everybody else does and chronicleize them and then figure out what is going to work best for me. And so I guess I've been saying what works best for me. But what you really need to do, what everybody that's listening to this, if they are studying for step 2, you really need to take a second and think about what your strengths are and really be honest with yourself and how you're going to go about, because this is a beast, right? This is not an easy test. So what you want to do is take a second and figure out how you're going to approach this test. From there, start to make your plan on how to attack. Don't just do what everybody else is doing. Take a second and think about how you want to plan this out. And if you make a plan, if you make a study plan and a test day plan, it will go way smoother than if you're just like, well, I watched a video and this guy told me this. There's things that you need to plan out everything on the test day so that you don't have to worry about things like food and, and good food, not crappy food, things that your brain needs, in the same way with the prep, do the prep the way that you are planning, what is successful, how to get there, you've watching all these things, but you also have to tailor it to fit your own self, whether it be, I'm better in the middle, so let me ease in and then kill it. Or you're like, I know that I've just got to rocket fire through this.
Yeah. So what is a good step 2 score? For everyone.
For everyone?
Yeah. What's a good average?
It depends on what you're trying to get. I think the average is 230.
What about step 1? What's the average for step 1?
I think it's a little less. So 220 to 15-ish, I guess. I know it's a little less.
Okay. Just to give everyone a ballpark, yeah.
Yeah. It's 220-ish. I think passing is 190 for step 1, and step 2, I think it's the difficult thing is it's a multifactorial thing to get into a residency, and that's what this test is to get, and so it's just because you did really well in step 2, you know, they also factor in step 1, and they also factor in your application. So what you really need to do is just get the score to get in, whatever, you know. And so it depends on your specialty. But if you're going like emergency medicine or like IM or something like that, you really want to have like a 230, 240 and show progression. Like, let's say if you did bad on your step 1, that's fine, but they want to see that it got better.
Yeah, yeah.
So you don't have to go like 210. Like if the average is 230 and you say you get a 210 on the first one, you don't have to get a 250 so that it averages to a 230. But if you got that 230 and you had the other qualifiers, then people aren't going to care. But, you know, it's just
basically you're saying don't kill yourself to get like an unnecessary score. That's not gonna matter.
But you gotta, I mean, the thing,
like, know what you're shooting for. Like, if you did
what you're shooting for
the first round, and you're trying to go neuro.
If you have
like
no plan, you will not pass this test like that. Like I'm saying, like you need to know what you're going to achieve, how you're going to achieve it. You need to take a second and think about, you know, and that's if you're like, oh, I got to make a 240. I want to go into neuro, so I got to make a 250. It's possible, but you need to those people are gonna have to put a lot more work into it.
Yeah.
If you're doing like some of the specialties that don't require like as high of a step score, which would be like family, pediatrics.
Then also know what you're shooting for. Of course, study hard, but like plan for that.
Yeah. And like even I got a friend today that like she was super worried about her step 1. And her step 2, she was like, it's not, like, nobody ever wants to tell you their score,
She already took it?
Yeah.
Oh, okay.
She already took it. But she was like, it wasn't the best, but it was better, and she's got like 40 interviews. So I was like, all it is, like, she was nervous, because even then, she was like, it's not really that great. She didn't want to tell me. And I was like, it's obviously good enough to have some people look at you, so cheer up. Like, you know,
don't stress about it because everything will work out. Yeah.
Yes, that's not the do all break all, but you know, it matters a lot. And it's
especially if you did bad the first round.
Yeah,
but I guess changing it. They're changing it to where the first
round... They have
round,
changed it.
Oh, okay. It's already implemented? Okay, so the first round isn't going to matter as much as the second round anymore, right?
Yes. Yeah, I took it when it mattered, but... Yeah. But, it's just pass-fail now, which is great. Yeah. It takes a lot... Like, that's one of the most stressful moments of medical school. And they were attributing a lot of like the mental health issues and everything to prepping and then not getting the grade and all this other like.
I believe that.
And it's weird because there's a lot of people that are forcing themselves. They're squares shoving themselves into circle blocks trying to be doctors, and they're not. They don't really want to be. And then the stress, and then the mental health, and then you have to pass this test, and you don't like if you've never worked in the hospital, so you don't have that passion beforehand, you just like have this feeling that you want to be a doctor, and there's just this overwhelming amount of stress to get to a job you have no idea what's going to be like after you get there.
On top of the financial burden you have built yourself.
I can see how that would be. Yeah, like I got lucky because I was able to see what I was wanting to achieve. So I was like, okay, I have a goal, and I know at the end of it, this is the crappy part, and at the end of it, I get to work with people and everything else. But if you've never seen that, I thought about that too, because there was a lot of people that I knew that they're just parents wanted them to be doctors, or so they were like, oh, I was doing this, I was, and I was smart enough to get into medical school, and and you're like, but they were the most stressed too, because
they a lot relied on them, basically.
They just and it's. You don't know what you're going, it just seems like a lot for nothing.
Yeah. I mean, they could realize, they could take this test, get into the field, and realize, this is not what I expected at all.
Like, you're just doing it because it seemed like a good way to get money.
Yeah.
You're like, oh, I joined this accounting class. I bought some stocks because I wanted some money. I went to medical school because I wanted some money. But
Buy
then
the
it was
stocks.
like,
Buy the stocks, everyone.
but it was, yeah. And then they put you in Squid Games, and you're like, what?
Yeah, so true. Okay, so what programs do you use exactly? What materials do you use to study for step 2? Is it different than step 1, or is it about the same? Or?
So, yeah. So step 1, it was different. There was heavy reliance on the first aid book. It heavily recommend, like, it's a book. Yeah, it's a big textbook. You essentially get it, like, you should get it at the very beginning of medical school, and then it should be like your Bible. And you should pay attention, because it's going to help you the most with those, like, weird associations and stuff like that. The step 1 was first aid, a little bit, a lot of UWorld, and a little bit of sketchy, which was like these videos that they would do, like these interesting sketches where it'd be like either it'd be Star Wars or like pirates, or there was a Peruvian one, and it would just explain, like, it'd be like these type of drugs or this, and it would describe like the type of drug in the sketch. It's called sketchy.
Oh yeah, no.
Yeah. Like, it would be like a Star Wars, and it'd be like the Death Star is like the ring. So these things have a beta lactam ring, and then anytime you saw the Death Star, you knew that was the kind of drug that had a beta lactam. So it's weird. Those kind of Like they do a great job, because you realize later there's small associations after watching those, and it's been 6 years or 2 years, right? It's been 2 years, 6 years.
6 years.
No, but it's been
feels like 6
feels
years.
like it. But it's been like 2 years, and I'm like, oh, I kind of remember there being an Indian, because they do like a red man syndrome, Steven Johnson, like this terrible rash you can get, but they would do like I think there's like an Indian man, and then there was like a guy that was like bright red in the sketch. And I remember even a doctor was asking me about it, and I was like, I'm pretty sure that this is the complication, because I'm thinking, what is the complication of this drug? And then I'm like, oh wait, maybe it's this. And he's like, yep, that's what it is. Like,
that's clever. And I mean, it helps you, the fact that it's been 2 years or 6 years, whatever.
Yeah, it's
and you can remember these sketches or these illustrations like that. I mean,
it just gives you something. Yeah, physically to visualize when you're thinking of something in a mental.
But you don't use that now, right? I mean, technically,
I've kind of already watched them. Yeah, like, I have a book of the sketches, and sometimes I go back and flip through. But really, so it's first for step 1. It is first aid, UWorld, sketchies. You should look at. There's it would be good to get another question bank, but I didn't get one. Or I had like past test or whatever, but I wasn't really using it. It was just using a lot of UWorld. But for step 2, it's mainly like, it's a lot of questions. Like, there's not like the first aid. There's like a get them to the boards book, and I'll, review that a little bit later on another episode or something like that. But it's a bunch of UWorld questions, a bunch to get ready, because it's all about management. So it's like what to do in this situation, what to do in this situation. I do UWorld. I do online med ed. They've got some videos. I love to drive and listen to the online med ed videos while I'm driving or while I'm walking Riley, because you can even like swipe up and be texting or doing something else while the video's playing. Like, it doesn't have to be like YouTube. Like my YouTube, I can't do anything else while it's playing.
You can multitask during.
Yeah. Like, if I'm walking Riley and somebody sends me a text, I can also still listen to his video and answer the text.
Yeah, my YouTube, like, if I close out, it's done.
It's out, yeah.
I haven't paid for the
No. Yeah, I guess I was thinking that too. I was like, I guess I could pay for, but I'm not.
Nah.
Yeah. But yeah, so I do online med ed. They have these videos, but it's really just questions. And then I got a second question bank. This is like a crucial aspect. Is you want to do UWorld like with all the like, you can separate the questions by the type, like OB, psych, blah blah blah. But you want to do them all mixed together like it would be the test. So you want to do 40 question blocks of it like it is the test. So I get a second question bank, and I do all the cardio questions on the Kaplan question bank, and I do all the GI and all of that in a row. Like I do 40 questions of GI, 40 questions, and I do it like like last week I did all the cardio and all the GI questions from Kaplan, and then I would at the end of the day I would do the 40 questions mixed after I had done 80 or whatever of just solely one style of question, and that way I could get like some knowledge on the topic. Like I did all the questions on the GI bleed, so now I feel confident about doing GI bleed questions, and then I do everything at the end of the day. Yeah, the key is to get one question bank and do all of them mixed together, and then have a separate one that you can do and do them individually so that you can get all the information.
Okay. That makes sense.
Does that, yeah.
No, that makes sense. Yeah.
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 So yeah.
Is there like an amount of time you should study for, or is it more of just like going through the amount of questions? Or okay, so is there an amount of time you should study for a day, or is there an amount of questions you should do a day? Like,
I guess it depends on the person.
Okay, let's talk about you.
Yeah. I think
what is your goal for the day?
Like, I think my goal for these days have been the 160 questions, 160 to 200 questions. And I do Anki if it's past that, and like do those, review those, then Anki. And then from the end of that, there hasn't been much more time in the day.
Yeah.
It's so ridiculous.
How long does it take you to do 200 questions?
I mean, that's 5 blocks, so that's 5 hours, at least 6 hours.
Okay.
So,
Yeah. No, I mean, I don't know.
It's like 6 hours to do the questions.
Sure.
And
it's
then,
a long time,
or 5 hours, and you're like, heaven forbid you went to the bathroom or you did, laundry or something, then it's an extra hour added.
You ate. Heaven forbid
you ate.
Eat.
And so,
that makes sense.
And I've been trying to, like, map it out. Like, I was like, if I can do, like, 8 to 9, maybe even 10 hours of studying a day.
That's like a regular work day.
Yeah, every day of actual studying. Like, I don't, like, sitting in front of your computer with your phone out is not studying. Like, you have to actively be, then reviewing, I might have a chance.
And, you have to actively, you will. You're going to be fine. But you have to actively go through the questions and then go through and review the ones you got wrong, because you are going to miss some. And then after that, like, dive deeper, like, if you still don't understand, and then go back and try again maybe, or do a different bank or whatever, right?
Yeah, that's
it's very long.
It's very, very long. And like the review process, like the good thing is, like, especially like I'm fresh out of OB, right? So I see an OB question now, and the people in my OB rotation, they did a very good job of like teaching me, and I actually learned a decent amount. So like when I do one now, I'm very, very confident when I'm doing it. When I get it right, I don't have to review it, because I'm like, okay, like she had painless vaginal bleeding, she was pregnant, we knew what it was, I knew the answer, move on. I was able to figure it out. If there is something, I was like, oh, okay, I see where I slipped up, I can move on. But there's some things that I haven't looked at in a long time. I'm like, oh my God. It's like a whole chart of like ways you should handle things, like
formulas.
The good example that I was using, which is not something like I actually understand this because I'm thinking of it right now, but it's breast masses, right? So it's like if there's one breast mass, it literally is like a branching chart. Like, you know what I'm saying? Like, it's like, if there's one breast mass, then you move to this side. Like, and if there's 2 breast masses, you're going to go to this side.
Like a family tree kind of thing?
It literally looks like a family. And it's like, and if there's one on both sides, you're going to move to this side of the chart. And if there's one on this, there's only one, you move this side. And it's like, if it's loculated or something like that, you're going to do this if there's 2 of them. And if it's, if there's something else, you're going to do this if there's 2 of them. And then if there's... Okay, yeah. So, there's things like that where you're like, oh, crap, I forgot, like every step of... Like, should I mammogram it or ultrasound it or what? What are all the steps to actually getting to it, something? There was one, and this is a good example, like, when you haven't eaten a lot, it's called refeeding syndrome. When you haven't eaten and then they give you all the nutrients back in the hospital. Let's say you were like homeless out on the streets, you haven't eaten, they get like, they look severely wasted, like wasting away. And you give them like all the appropriate vitamins and everything. There's an actual condition where once you're starting to get all this insulin and everything back to regular levels, all your electrolytes go back into your system or go back into the cells. Like you're messing with the actual body chemistry. And it's called refeeding syndrome, and you can get really low phosphate and magnesium levels. And it's really bad. Well, I read this, see that it is refeeding syndrome, know what it is, and it was asking, like, what is it? Does it have hyper or hypophosphatemia, hypo, and just a bunch of and I was, in my head, I knew the answer, but I was, like, in the middle of the testing thing, and I was just like, okay, I think it's hyperphosphatemia, click it, move on, and I got that question wrong, even though I knew it. So there's certain thing, because I wasn't up to date. I knew it was the phosphate level, and but I didn't know if it was low or high, because I couldn't remember. I thought that it actually, something bad happened and it raised, and that was the bad part going on, but it's actually that it lowers. Okay. But I couldn't remember, because it's literally like a circle thing where it's like, once this happens, and 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 at the very end, it was like, these are the levels that are different. And so I'm like, oh, what was that thing I remember looking at? I was like, hyper, and move on. And then I get it, so there's certain things that I have to catch up on.
Yeah.
And they're like, oh, God, I can't believe I missed that. No.
Do you find yourself, since, like, your first rotation was peds, and then your second one was what, IM?
Yeah. IM surgery.
Missing more of those questions than, like, OBGYN and psych, the ones you just had?
I think if I get a lot of peds questions on my test, then I might actually make a decent step grade. Nah.
But you enjoyed peds, so that helped.
Yeah, it was something. But yeah, no, I definitely don't remember it near as clearly. Okay. They're like, especially IM ones from, like, I thought, because I did so many questions in IM and I kept doing questions. I was like, there's no way I'm going to forget. And some of the things I'm not going to forget. Even by the assessment, like, you're like, when the assessment comes and the test is on, you're like, oh crap, like, I missed that concept. I'm ashamed at how much I didn't show out as much as I wanted to on my own assessment, but that's the reason you do the practice ones. But the IM ones, I struggled. I did average to lower than average.
There's a lot to IM anyways.
Yeah.
So.
The pediatrics, the good thing about the pediatrics is it's about age, and a lot of the stuff I do remember because I've had so many, like, siblings and everything. Like, the baby stuff I remember, and then it's only about, like, the muscle stuff and everything. I can sometimes iffy that stuff out, but the time difference, the gap, it makes a huge difference.
Yeah.
Like the surgery IM questions, I'm like,
hammering those hard. Because,
yeah. I have to. Yeah. That's like 60% of step is IM anyway.
Wow, 60. That's a lot.
Yeah, it's something over 50.
I knew IM in general was a lot. I didn't realize it was like that big of a portion.
Yeah, it's definitely over 50.
Okay, so last questions before we wrap up. This past week, you studied, you did a test assessment.
Yeah. And I definitely recommend doing the assessments weekly. That was another thing okay.
So anyway, the first week you did an assessment and you didn't do very good or as good as you wanted to, right?
Yes.
So how do you prepare for that this upcoming week?
I am planning on doing more material learning. I've reviewed the assessment. I understand that a lot of the mistakes were dumb mistakes.
So do you go over the same material that you went over this week, or is it new questions?
Yeah, I've already done, that's what I was trying to explain, is like I've already done like cardio and GI in my other question bank. So what I'm going to do is I think it was like hematological disorders. And then one of the things that I didn't do too hot on my exam was like MSK stuff, which they were asking a bunch of weird questions and stuff on it. But So I'm going to do all the MSK questions and all the hematologic questions, like the blood questions this week, along with doing my other questions and hoping that all of it starts to build up on top. Does that make sense?
No, it does. Yeah. And then you'll take another step.
I'll take another assessment at the end of this week. I'll let y'all know next week.
Yeah.
Yeah. So we're making it.
1 week at a time, one step.
It's
literally.
ridiculous. And then you have to go into it with the mindset that you're not going to know everything too. Even in the assessments, you're like, what? I've never even heard of this. Yeah. While it's on my mind for everybody listening, ciguatera poisoning. Never heard of this before. I mean, I knew of it in a loose thing from the Discovery Channel. But when I read the question, I was like, well, I don't know what that is. And then as I read it, as I read the question, it makes no sense why it could have been any of the other things. Like this guy had just eaten like grouper at a restaurant and then was having like tingling around his mouth and having all these weird symptoms. And I was like, well, that doesn't explain like botulism or any. So I was like, so I had to go with that, but that was the answer. But so anybody that did not know what ciguatera poisoning is, because I did not know the actual effects of it. But ciguatera is it's a neurotoxin found in several large reef fish, so like moral eels, groupers, barracudas. But it's really just like sensory neurologic symptoms.
Sorry. I just pictured someone ordering, I'll take the barracuda,
I'll take the barracuda. Yeah. Well, grouper.
Yeah, you said barracuda, so it just made me laugh.
Barracuda. Yeah.
Sorry.
But it's really just going to be sensory symptoms like paresthesia, temperature deficits, painful sensation at one's teeth, and painful urination, pruritus. And so it says sensory predominant neurological symptoms along with transient GI upset, vomiting, and diarrhea. And it says that the neurologic symptoms can sometimes last weeks and that bradycardia and heart block may also occur. And like the person that he had just eaten grouper 2 days ago, and he had like a burning hot sensation, like where cold water felt really hot in his mouth.
That is weird.
Exactly. And I was like,
that happens?
I was like, okay. And then, and then he had some vomiting and diarrhea the day before. So I'm like, what in the hell is this? This is obviously a poisoning that I don't know. And so you're able to answer the question, but like, you're like,
what is it?
This isn't in the curriculum,
Yeah.
But you're having to answer.
That's like such a rare one, I feel like.
Well, in my OB shelf, I answered a question on how long sperm stays viable after a vasectomy. It's like, this is OB. Like, yes, it was like, the question was framed like, when do you, like, how long do you wait to pull out the IUD after the man has had a vasectomy? Like, so it's like, the question is only asking how long does sperm stay viable after the man gets a vasectomy. But it's like, so that's nothing to do with OB besides you pulling out the IUD. Like, I mean, I guess it is. Yeah. But it's like the question's asking only about sperm, like male stuff, not.
Wait, so were you saying the Sigma Terra, whatever that was?
Ciguatera.
Okay.
Ciguatera.
That was OBG.
Just do a loop of that. Ciguatera.
Oh my god.
Ciguatera.
Okay. So you were saying that was an OB question?
No, that was just on my assessment the other day.
Oh, okay.
Like, it was just a random. No, the OB one was asking about when should you pull the IUD out.
Yeah,
and it was like 2 months. Yeah. I was just saying that questions that don't make any sense in the format that, like they're not. You wouldn't have learned that. This one, I guess you should know what ciguatera poisoning is. I just didn't know.
See, I feel like you should know the other question more than that one.
Yeah, but my thought is, how is that an OB question though?
There's an IUD in there.
But yeah, I guess the concept is how long does sperm stay viable after a vasectomy, which is not an OB concern.
What other category would it be?
The guy that's doing the vasectomy. So like it. GU.
Okay. That's what I'm asking.
Oh, yeah. Like the guy. No. I was thinking in my head. No. I was thinking in my head too, like what it would be. I wasn't trying to be. I was trying to think of what it would be in my own head. Like I would assume that it would be that style of question. I mean, I understand because it's the IUD and it's asking it in the way of the female, like when you should. So it is an OB question. I get that. And I'm really just harping on something that I got wrong. But the actual like knowledge it takes to figure that question out is like not part of the female anatomy at all. You know, it's just a male. Yeah. Like, how long does sperm stay viable? Yeah. It's not like, is this lady pregnant and bleeding? Is this lady, you know, it's like almost like something that an actual, and I brought it up to multiple physicians, like in my OB thing. I was just like, oh, yeah, you know, like, and they were just like, oh, God, I don't know. They were like, the only person was the 70-year-old physician was like, about 2-3 months, right? I was like, Jesus, nailed it. Sir.
There you go.
I was like, of course you know. Yeah. Everybody else was like, man, I don't know. I might have to Google that. It's 30 ejaculates. About a couple months. Woo! No, yeah. So we've been obviously, my mind is scattered and loopy because I've been studying so much. But that's what you get, guys. I'm sorry. Just it's just a little step-oriented pod for the day. So we appreciate everybody that's been listening. Thank you, everybody. It's been great. All right, have a good day. We out.
Hey everyone, I want to take this time to tell you about our friends over at TrueLearn. They have this top-of-the-line test bank that is perfect for any upcoming board exams that you may have. They have test banks for all types of exams. So whether you're studying for medical school, nursing school, OT, pharmacy, and others like speech pathology, TrueLearn is the way to go. If you're like me and going through medical school, they have question banks for all the big exams, like Step 1, Step 2, and Step 3, with quality assessments for each exam. Look, I know we didn't go into healthcare because we love taking tests. This is the hard part of the job. Make it easy on yourself with TrueLearn. Sign up now with the code OFFWHITECOAT to get $25 off your purchase. That's OFF white coat, no spaces, to get $25 off your purchase. This is a test bank that you do not want to pass up on. Make this easy on yourself. Take the deal, pass your boards, and get back to enjoying the reason you went into healthcare. And make sure to use Off White Coat when you pick it up.